only on News 3 at 6. In the coming weeks, as spring break nears, folks will start traveling to warmer climates, and with that will come a risk that up until now has been low for us here in Wisconsin. The Zika virus. At particular risk are women who are pregnant or trying to become pregnant. Our Dave Delosier joins us with a story of a woman 14 weeks pregnant with a trip scheduled for Florida. Dave.
Yeah, Eric, a tough decision for her. You know, Florida is on the very fringe of the Zika transmission map. The Aedes aegypti mosquito, which carries the Zika virus, is present there. So it raises the obvious question. Many are asking, should you take the risk?
I'm due August 29th.
And like most, Emily Higuchi and her husband are entering the unknown that comes with being first-time parents.
I have no idea. I don't even know what I don't know.
But what she does know is she was registered to attend a medical conference next week in Florida. That region is on the fringe of active Zika virus transmission cases. The Aedes aegypti mosquito is the primary way the virus is spread, and that mosquito is in Florida. In pregnant women, the Zika virus has been linked to birth defects, and there is no known treatment for either the mother or the unborn child.
So we're getting phone calls at least once a day.
Calls from women concerned about travel to active Zika regions. Kathleen Antony is a maternal fetal medicine physician at UW Health. As spring break nears, she says the Zika virus needs to be considered by women who are pregnant or trying to become pregnant.
If they're traveling to a known Zika-affected area, and that list is constantly being updated on the CDC's website, then we recommend that they either postpone the travel until after the pregnancy is completed or cancel the travel altogether.
I talked about it with my husband, and we thought that it just wasn't worth going this year, at least.
For Emily and her husband, the trip simply wasn't worth the risk that one mosquito bite could bring.
I just knew that in this situation, I wouldn't want there to be any sort of decision that I made that maybe could have put any additional risk that was reasonable to avoid.
Now, the reality of that risk is very clear in the 9 pregnant women that in the U.S. that were exposed to the Zika virus. The CDC is monitoring those 9 cases. And Eric, the thing about the Zika virus is this is such a fluid situation in that they're getting cases in new areas. So probably best advice for women who are traveling, check with your physician because they're staying on top of this.
Yeah, check with your doctor, but you can see her point. I mean, little tiny risk, but we're talking about a pregnancy here.
One bite.
One
bite from a mosquito.
Yeah, check with your doctor. Good advice. Dave, thanks.